So what made you become a doctor, Dr. Schur?
Well, when I was in high school, I think as a sophomore in high school, I had an acute appendicitis, and it became perforated, and it was a very close touch. And as I was recuperating at the hospital, and remember this was before antibiotics, so I had a really tough time. It was touch and go for quite some time, and it was at that time, I think, that I developed an interest in medicine, and I pursued it from there on in.
So where did you go to medical school?
I went to medical school at Middlesex University School of Medicine, and I had been at Valparaiso University for my pre-med training. After medical school, I had a year at Milford Memorial Hospital in Milford, Delaware, and this was followed by a year at Lutheran Hospital in Cleveland, Ohio, and another year at Grace Hospital in Cleveland, Ohio. I enjoyed my 3 years very, very much. I started practice then here in Oxford in 1944. My office is in the same location. I have been in solo practice for the past 58 years, and I have had 1, 2, 3 secretaries in the course of those 58 years. Originally, we lived in the same home as where the office was located, and incidentally, that office was purchased from Dr. Elliot Jocelyn of diabetic fame, who was a native of Oxford. And 51 years or so ago, we moved to this place because of the family that was getting a little larger. Okay. The reason why we moved is that we had a total of 11 children, and that house was simply outgrown. As far as my daily life with those 11 children, I have to pay a special tribute to my good wife, who not only tolerated me, but also was able to raise very, very effectively the total of the 11 children. One of the family chestnuts is that Mrs. Schur is a registered nurse. We met at Lutheran Hospital in Cleveland while she was a student, and we often say that we met on the maternity floor, and she really never got off the maternity floor with 11 children.
Could you tell me when exactly you graduated from medical school? What year did you graduate?
I graduated in 1944 and have been in solo practice ever since. I've never had a problem with appointments. I've never had appointments during the period of time that I've been in office. I oftentimes have polled my patients to see if they wanted to have appointments, and they said, no, we like to have the walk-in. And so this is what we've had all these years. And I'm presently still engaged in practice on a limited basis. Yeah.
So do you find yourself seeing pretty much the same patients you've always been seeing? Do you feel that you owe them, you still owe them the right to see you since you've been seeing them so long?
Yeah, I've always felt that I've been a part of the community, and I have known my patients not only as patients but also as acquaintances and friends, which has made it nice in a small community. When we moved here to Oxford, Oxford had a population of about 3,500, and it is now probably 12,000, 13,000 in size. And it's been a wonderful community, and I have enjoyed knowing all of these people. I've been engaged in a lot of community activities, having served for 25 years on the school committee here in town, and this gave me a good opportunity to know community efforts too.
How do you feel the role of the physician in the community has changed over the past 50 years?
Well, of course, we've had the introduction of HMOs, which has posed a different approach to the practice of medicine. I have never participated in an HMO. I have had other insurances. I have had Blue Cross Blue Shield, but I have never been affiliated with an HMO. And so as a result, the attrition that has taken place in my practice has been due largely to the fact that my HMO patients have had to go elsewhere. It hasn't been unusual for a patient to come into my office and actually be very sad, and on a couple of occasions to actually weep, to tell me, you know, Dr. Schur, you've been our family doctor for many, many years, and now we have to leave you because my husband has an HMO affiliation, and we have to find another doctor.
So would you care to describe a typical day of practice when you first started here in Oxford?
Yeah, that was interesting, particularly in view of the fact that I spent so much time in my practice. I had office hours Monday through Friday from 1 to 3 and from 6 to 7 in the evening, and also on Saturday afternoon. My mornings were spent at the hospital and also making house calls. I've made house calls all my life, and up until 4 months ago, I was still making house calls. Yeah, and I then at noon I would come home for lunch, and Mrs. Schur and I usually had lunch together, and then after the afternoon office hours, I would make house calls again. And then I had evening hours. I was also doing a lot of obstetrical work, and so I was up much of the night. And so as a result, my family maybe didn't see a whole lot of me, but what they did see was quality time. I gave my kids adequate attention, and they were here always. I was here always to know that they were seen, and my family understood and cooperated with this kind of life a great deal. Over the years, I often think how in the world I could have led that kind of a schedule, because I look back now and I say it's almost inconceivable that I was working that many hours.
So over the years, your hours decreased?
Yeah, I would say perhaps over the 10, 15 years. Up until that time, I was still active in obstetrics, and did a lot of house calls. And so, yeah, the attrition has taken place in the past 10 or 15 years.
Okay. Have you used the telephone to talk with your patients often?
My telephone presence was always available, but it seemed as though my patients would prefer to come to the office to talk to me. It became a person-to-person involvement, and I was always available for them.
Could you describe your rounds in the hospital?
Yes, they started very early in the morning, very early in the morning. And I did a lot of assisting in surgery. a lot of assisting in surgery. And my hospital caseload would vary from 2 to 3 in the hospital at one time, up to maybe 7 or 8 in the hospital at one time. And I would make rounds in the morning while I was there. And then, of course, I was on call all the time for obstetrical cases. And then, of course, in the afternoon, I came back here and had office hours. Yeah.
So, did all of your patients live around here in Oxford?
Yes, the majority of patients lived in Oxford and also still do, but I have and did have a lot of patients from the surrounding towns. Auburn, Webster, Charlton, Sutton, Leicester, and I went on house calls all the way to, all the way to Leicester and all the way to Charlton. And so my presence was felt in a pretty wide area.
Oh, just getting back to your family life quickly. Did you ever take vacations?
I have always been very closely involved in church activities on a local basis, regional basis, and even national basis. My affiliations with the church societies required a lot of traveling to St. Louis, for instance, and my family would often go along with me to those. At one time, I was on the board of directors of our Lutheran Laymen's League organization. I was on the board and also chairman of several of the important committees, and we would go to the conventions and my family would go along with me. Otherwise, the vacations were more or less on a short mini vacation style.
So what have you really loved about your practice? What has made you keep being a doctor for so long?
The important thing about keeping interestingly involved in my practice is the person-to-person contact. If I didn't love what I am doing, I would have retired fully a long time ago. But I like what I'm doing, I like my patients, and I think and I hope that they like me, and it was this personal relationship that I really, really enjoy.
And that's why you never became a surgeon, right?
That is correct. That's why I chose family practice, yes.
And why did you choose to practice here in Oxford?
Why did I select practicing in Oxford?
Yes, you might have said it.
I had been deferred for military service, not of my own accord, but of procurement and assignment for a number of years. When I was in Milford, Delaware, I wanted to get into the service, and I was instructed that I was needed more as a hospital resident. And this followed for the next 3 years. Then, when I was ready to start private practice, I started to investigate various places to practice, including my hometown of Webster. There were no offices available nowhere.
Go on.
There are no offices available anywhere, not even second floor offices on Main Street in Webster. This place was available. There was only one other physician in town at that time, and there was a great need for a doctor here. And I've loved Oxford. I'm glad that that choice was sort of thrust upon me.
So what were the most typical illnesses that you dealt with early on in your practice?
Do that again, please.
What were the most typical illnesses and diseases that you dealt with early in your practice?
Well, we had the usual colds, and we had hypertension.
Right.
We had cardiac conditions, and this is where so many of the changes took place in the practice of medicine. Over the years, I can recall early in my practice where the treatment for hypertension was a matter of salt restriction, changes in lifestyle, weight reduction. There were no medications that were available at that time for high blood pressure. And there have been so many changes too in the treatment for cardiac conditions, as well as so many embellishments of the facilities that were available, echocardiograms and CAT scans and other means of diagnostic helps. And so there have been a lot of changes that took place, yes.
And in subsequent decades, how did the illnesses that you treated change?
Again?
How did the illnesses that you treated change in subsequent decades?
Well, I think that we have had a lot more emphasis on diabetes. Let me interject this about diabetes. In the 1944s, Dr. Elliott, whom I mentioned before, wanted to make a survey of diabetes and selected his hometown of Oxford. And at that time, there were three of us in practice, Dr. Lundy, Dr. Hale, and myself, and we were involved in joining his staff and getting blood sugars from every single person in the community. And if this practice, or if this clinic had been continued, I think it could have been as important as the Framingham study, for instance, in heart conditions and cardiac conditions. And so there was a big emphasis of that at that time. Then, of course, we have had a lot more emphasis on many of the major problems. We know now about Alzheimer's, we know about HIV, we know about autism, but we don't know how to control those. And that's the important part. This research hopefully will continue so that not only these, but also the treatment of cancer can be much more effective.
What was the greatest challenge for you to treat when you started practicing?
I think that when we felt that there was nothing available to help the patient anymore, that was very difficult. And I think this is one of the things that I have always evidenced in my practice. It has been a matter of caring for the patient. If you can't cure the patient, and oftentimes this is so, at least you can care for the patient, and that helps a great deal.
What has been one of the most important breakthroughs in disease treatment throughout the course of your practice?
Well, when I was in Delaware, the advent of antibiotics was just beginning to show. We were close to Wilmington, Delaware. The DuPont company was instrumental in a lot of research, and we were one of the first hospitals that were offered the opportunity of using some of the antibiotics. We started out not an antibiotic, we started out with the sulfonamides, and from there we went to penicillin and all of the variances of the wonderful antibiotics that are available to us now. And I think that that's probably one of the important things. I think one of our real frustrations early in those years was polio. And when we were able to enjoy the work of Dr. Salk, it became a marvelous, marvelous step forward in the treatment of, one of my sons had polio, my second son, David, but fortunately he was, we were able to arrest that so that he has no problems at all at the present time, except that he talks too much.
What was the worst epidemic that you can recall?
I think it was the polio epidemic that bothered us more than anything else. We felt so frustrated, and we were so concerned about the outcome of this condition with the patients. Yeah. I'd like to tell you a little bit, or suggest a little bit to what I might offer as my advice to young doctors starting in. You want to do that later?
Yeah.
Okay, all right, okay.
So in terms of technology, what is something that doctors take for granted nowadays that you didn't have?
Well, yeah, we take for granted advances in radiology, which have developed from somewhat minor results to the wonderful effects that we have now. Mammography wasn't heard of at that time, and so as a result, screening for breast cancer has been very, very important. We didn't have the advantages of CAT scans. We didn't have the advantages of MRIs. We didn't have the advantages of ultrasound. And so all of these benefits, sometimes today we take for granted and don't think how difficult it was in years past to do without these.
What technology is still in use today that you use frequently early in your career?
Again, please.
What technology is still used in medicine that you used early in your career?
Radiology was, X-ray was one of the important things that we used at that time, yeah. And there have been a lot of advances, of course, in laboratory technique that we didn't have at that time.
Describe one important invention that you've seen, perhaps the most important you've seen throughout the course of your
I'm not quite good.
Describe one important invention that you've seen in medicine throughout the course of your practice, and yeah, perhaps the most important invention you've seen.
I'm not sure that I could limit this to one. There are many that I think have been very, very important, yeah.
Is there anything that you would like to see invented in the medical field, any piece of technology?
I'm not sure that it's a matter of invention, but I would certainly hope that our research in the area of treatment of Alzheimer's could be affected while I am still able to enjoy the results of that. I think that that is a horrible disease, to see one of your loved ones be with you and yet not be with you.
What were some of the most important drugs that you used early in your practice?
When I was still in Milford in my residency, we started to use the antibiotics with great effect. And I think that brings back to me a memory of almost exuberance in being able to use this kind of medication in the treatment of so many so many diseases.
And how did the drugs that you used change over the years to
Of course, there are so many new drugs that are approved by the FDA from year to year that sometimes we aren't aware, we just take this for granted. Can I get a drink, please?
Yeah. Did you always have access to the drugs that you wanted to use?
Yes. Drugs that you wanted to use, pharmaceutical preparations that you wanted to use and you prescribed were always given. There was no question about filling the prescription, if it was, you know, if it was valid. Nowadays, there are formularies that are developed by the various agencies, and sometimes I understand that you can't prescribe the exact drug that you want to. You have to use some kind of a substitute. But most of my practice, I've been able to use the drugs that I wanted to use.
What breakthroughs in drugs have you seen throughout the course of your practice?
I think the treatment of cardiac conditions, particularly in hypertension, also in diabetes. I think almost all of the systems of the body have had important advances in the changes of medicine through drugs. My concern about the present situation is that too many of the drugs are advertised to the public through all of the media, magazines, newspapers, radio, television, and as a result, sometimes little knowledge is harmful. The patients don't know enough about these drugs, and they will often ask for a particular drug when you're not ready to offer that drug. I think, too, that too much in the way of financial payment is made in advertising by the pharmaceutical houses. I enjoyed my visits from the pharmaceutical reps because I got a lot of information from them. And this has been cut back quite a bit. And in its place, they are using publicity rather than having a person-to-person contact with the physician.
How did patients without money receive health care early in your practice?
Well, did a lot of charity work. Really did. And oftentimes, well, I can recall visiting a family with many children, and the mother had me see 4 or 5 of the children with colds at home at the same time. And these kids were all seen, and a single charge was made for one patient. If the patient could not afford it, oftentimes it was written off or the charge was lessened. And my charge was very small.
So do you think everyone who needed health care received it?
I think more people had the availability of health care than probably than they do now.
Over the years, how do you think the Worcester area has compared to other places in terms of providing care for the underserved?
I'm not sure that I could answer that too adequately, because I think my emphasis was here in a smaller community. Yeah.
What were some fears and concerns about socialized medicine in the 50s and 60s?
I think socialized medicine has had a tendency to withdraw from personalization. I think the person-to-person contact that was had in previous years has probably been lessened to a big degree. I think yeah, I think I'll drop it there.
All right. Did you see physicians get involved politically on the topic of socialized medicine, or did you yourself?
Well, we would hear about this from time to time in conversations, and also sometimes in medical society meetings, but not too often. And most of the time, it was anti rather than pro.
What were your feelings on Medicare and Medicaid when they came around in the 60s?
I think probably it was pretty much of an unknown situation to begin with. And it was only after it started to develop that you were aware that something like this was happening. I didn't notice too much of a change in my practice.
So have your feelings changed about the programs over the years? Medicare and Medicaid.
Would you repeat that question, please?
How have your feelings changed on Medicare and Medicaid over the years, too?
I think it has come to the point where we accept this, whether we approve of it or not, we accept it. And there's no longer any question in my mind that this is here, and so I accept it, and I guess I have to approve of it.
How do you feel that the government's involvement in healthcare over the years has affected physicians specifically?
I think it has taken the power of choice away from the individual patient, and perhaps also from the individual physician more as time goes on. There are so many plans that are mentioned by the politicians, particularly in this year of election, and I'm not sure how many of those will ever come to fruition or if they will or not.
How do you feel the government's involvement in healthcare has affected patients?
Same way, I think there's a lack of choice as a result of that, yeah.
So, overall, do you feel that the public's access to healthcare has been affected in a negative way by the government's involvement in healthcare?
To my way of thinking, yes. Yeah. We look at times with other governments, and we look at all of the positive results of their plans, but we often overlook the negative aspects of their plans.
What would you like to see happen with the government in healthcare?
Frankly, I don't know. Frankly, I don't know. I think I would like to get back more to the private physician having more of an impact than it does now.
Well, let's move on from the subject of managed care now. Oh, could you tell me how much it cost for you to go to medical school?
And I honestly don't remember. It's been 58 years, and some of those things I choose to forget, I guess.
Did the cost of medical school influence you in where or how you choose to practice?
I don't think so. No, I don't think so.
How do you think the increased costs of medical school today influence the choices of young doctors to graduate?
I think it has a great influence on choice of going into medical school. As a matter of fact, the number of applicants has declined over the past couple of years, not terribly much, but quite a bit. I had one girl in my medical school class, and now the percentage is almost even, 50-50. Yeah.
How have doctors' salaries changed over the course of your practice?
When I first started practice, my office calls were $1.50. My house calls were $2. I think it was $1 or $2 more for a night call, and you know, that is like comparing pennies with high bucks these days, and we managed very, very well. I was able to raise a family of 11 on my income, and we lived comfortably, not sumptuously, but comfortably. My kids have all had a college education, and none have gone into medicine.
So did most of your income come from the office visits?
Yeah, from office from office visits. In recent years, I have been school physician. Well, ever since the school started, I've been school physician at Bay Path, and in the past several years, I've also been school physician at Oxford High School. So those have been additional sources of income. And I've enjoyed that. I've enjoyed my association with the young fry.
Would you like to talk more about that experience?
Yeah, when young people come to my office, oftentimes our conversation drifts away from their real reason to be there. I try to find out what their interests are, what they plan to do. I emphasize the importance of not smoking. I emphasize the importance of clean health and so forth. And so my association with the kids has always been a good one, and I think that they have enjoyed that also.
Could you describe how attitudes towards smoking and lung cancer have changed throughout the course of your practice? Could you describe how attitudes towards smoking and cancer have changed throughout the course of your practice, just in general?
Well, let me begin by saying that I smoked. But I quit in 1962 before the Surgeon General said that it was harmful. So there was no warning at that time. I just quit. And I am very, very pleased that, of course, that I did. I have emphasized the importance of not smoking because more and more we are reading in medical literature that smoking is a risk factor not only in the respiratory system, but in practically all of the systems in the body. And so I emphasize that strongly. I was doing a physical with a young man from Bay Path last year, and he said, "You know, doctor, 4 months ago I quit smoking, And I shook his hand and I said, you know, this is the best information that I've had today. Congratulations. It's important.
How did you learn the business of medicine?
By practice, by trial and error to a big degree. And recall the business of medicine was much different a half century ago than it is at the present time. Record keeping has always been important, but I think it has been doubly important, triply important in recent years. And it's been by experience.
What are some changes that you've seen in the demographics of this community?
Well, this community has grown. And at one time when I knew practically every resident in the community, I'm often greeted by people who know me, but I don't know them. And my wife often says, you engage in conversation as though you've known them for a long time. And I said, yeah, I know. That's true. But yeah, the demographics of the community have changed here, but probably being a small community have not changed as much as the larger cities. Early in my practice, Oxford consisted mainly of young people and the older stratum of population, older people. The middle group was pretty much minimized because they moved out of town to find their welfare elsewhere. Now this has changed a great deal because there is an influx of new residents, and we have an admixture of young, middle-aged, and old throughout the whole area.
Has the ethnic background of your patients changed over the course of your practice?
If it has, it's been imperceptible. However, I can recall that North Oxford, which is a big segment of the community, was almost wholly French or French-Canadian. And that, of course, has changed. And this was much of my practice evolved from North Oxford. And these were just absolutely wonderful, wonderful patients to take care of. But the complexion of the community is pretty much of a mixture at the present time.
What major changes have you seen in women's health over the past 50 years?
I think more emphasis placed on women's health. Even today we are saying that some of the studies have been limited to men, and now they are beginning to study more the health aspects of women. I think that a much greater emphasis is being placed on screening of breast cancer, for instance, and perhaps other systems as well. I think more emphasis being made.
And what changes have you seen in children's healthcare?
In which?
Children's healthcare?
In my own practice, I haven't seen much of a change.
Do you see young patients though?
Yep. Yep.
How has practicing here been different from other places that you've practiced?
I've only practiced here. Yeah.
What were public perceptions of doctors like early in your career?
Do that again, please.
What were public perceptions of doctors early on in your career in medicine? Public perceptions of doctors?
Oh, yeah. I think early in my practice, doctors were almost on a pedestal. And what they said went. And they were highly respected probably as highly respected as any profession. As time went on, physicians were questioned much more. That does not have a negative aspect. This has been good, but I think there have been too many frivolous litigations. As a result, malpractice insurance has escalated terribly, terribly, terribly. Each year it goes up, and each year whatever you're able to do has been limited. And I think this has all been because of the fact that the attorneys, bless their hearts, are suggesting to people that the least amount of problem that you have deserves to be ended up in court.
Would you care to talk more about how the impact of malpractice has changed on a doctor's practice over the years?
Yeah, I think that they are more cautious in doing what they do. I don't think that I would do many of the things now that I did early in practice and did them well. I did a lot of minor surgery in the office. I would not think of doing that at the present time because of the aspect of a possible malpractice suit. Confidentiality has always been important to me, but one of the things that, let's see, how will I put this? Oh, that thought escapes me. Okay.
Are there physicians that you admired when you started practicing around this area?
Yeah, there were many physicians, well, several rather, who had a great influence on my development. One that has remained really important. I think probably Leonard Morse has had a big influence on me.
What was it like for the female physician around this community in the 50s and 60s?
There was only one woman physician that I knew in Webster when I first started. We don't have any at the present time in Oxford. There hasn't been any invasion of the female gender in our community at this time.
How about generally in medicine? How do you feel the role of the female physician has changed over the years?
Oh, well, the female physician is respected much more now than you never heard of a woman surgeon, but it's not uncommon to have very excellent surgeons. Women are engaged in all areas of medicine at the present time. And it's interestingly enough, they have had a study whereby they said that women spend 2 minutes more with the patients than men do at the present time. That just came out yesterday.
How did group practices or hospitals treat minority physicians early in your career?
I don't think that the minority situation had any problem at all. I don't think ever. Yeah.
All right. Well, before we wrap up our interview, are there any stories or memories that you would care to share from maybe medical school or your residency or any time in your career before we move on?
No, just generally speaking, I can't recall anything specific, but just generally speaking, I think my greatest delight was in the area of obstetrics. It was always such an exuberant experience to present a newborn to first the mother and then the father. That's been always an exhilarating thing. And when I decided that the time had come for me to discontinue obstetrics, I felt an emptiness, yeah.
So you don't have a particular favorite memory or least favorite memory?
My big memory is the tremendous support that I had particularly from my wife and also from my family. Very, very understanding. We always had dinner together. No matter how busy I was, we always had dinner together. And this was important because it maintained the family unit and the family unity. And for this, I've always been. I was a fairly tough taskmaster, and without exception, my kids, when they reached the 20s, would say to me, you know, Dad, we always thought that you were tough, but we want to thank you for it.
Would you like to comment on changes in med school education or med school procedures over the past 15 years?
I think in more recent years, from what I read in the journals, there are more emphases being made on counseling, end-of-life approaches. Some of I think they are recognizing the importance that medicine is not only a science, but it is an art, and that you have to emphasize that aspect of it just as much as you do the science. I think that the patient has to believe that you are with him or her rather than talking down to him or her. Always remember that you should treat the patient with kindness and friendliness.
How has your particular field of family practice evolved over the past 50 years?
I have never been sorry that I entered this as my preference. I became a charter fellow of the American Academy of Family Practices, and I have been very supportive of that particular organization. I have had much support from them. A lot of my continuing education has been through them, and for this I'm very grateful. I've never been sorry that I decided to be a family physician.
With medicine being such a changing field, how have you found yourself over the course of your career keeping up in the changes in education after you graduated med school?
Yeah, continuing education has always been important, and although it is a requirement as far as licensure is concerned, I don't think that has anything to do with my attitude toward it. I've always done much, much more than the minimum required. This has been through lectures at, particularly at Memorial Hospital, St. Vincent Hospital, UMass Medical Center, Medical Society lectures that were made available to us, but very, very often the offerings that were made by the American Academy of Family Physicians. I started with their program of continuing education when they first started many, many years ago, and I still follow their continuing education program. I think it's important.
Lastly, what advice do you have for younger doctors aside from what you've already given?
My first advice is, or my first comment is, congratulations. That's great. I think that the physicians just starting in should learn to listen to their patient. It's important to listen at all times. And when you listen, give your patient full attention, eye-to-eye contact. Don't be semi-listening or quasi-listening and jotting down notes. Let them know that you are paying attention to what they have to say. Remember that the practice of medicine, as I mentioned before, is not just a science, but it's an art, and you have to complete that full cycle. And remember, tell your young physician just starting in, you may not be able to cure every patient that you treat, but you can always care for them. And that's very, very important. They know this. They pick this up very, very quickly. If you are just a cold scientist and, well, I'm sorry, but I can't help you anymore, that doesn't go. But take time to care. At all times, take time to care for your patient. Always be honest with your patient. They can detect this so quickly that it's not even funny. If you want to seesaw about, be honest with your patient. If you don't know, say so, and tell them, I will find out, or I will find somebody who does know. Never talk down to them. They are important, and take time to explain to them, and don't hurry. Treat nurses and healthcare aides with great respect. Remember that a nurse is with the patient many hours during the day. Your hospital call might be 15 minutes, and always remember that a nurse or a health care assistant is your associate and not your subordinate.
Well, I guess that brings us to the end of our interview today, Dr. Schur, unless there's anything else that you would like to talk about or mention before.
No, only that I wish you great luck and success.
Thank you very much, Dr. Schur.